Good afternoon to all delegates and welcome to the next session at Scientifica 2022. I, Dr. Rucha Rayas, Assistant Professor here at Sancheti Institute College of Physiotherapy, Pune, welcome you all to the panel discussion on challenges in setting up a private practice for cardiorespiratory rehabilitation. Before we dive into this interesting topic discussion, I have the pleasure of introducing the chair for today's session, Dr. D. Anandi. A warm welcome to you, ma'am. Ma'am has done her undergraduation from College of Physiotherapy, Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore. Master of Physiotherapy in Advanced PT in Cardiopulmonary Diseases from the same institute. Presently, she is professor at SRM College of Physiotherapy, Kattankulattur campus, where she is also pursuing her part-time PhD. She is member of Board of Studies at SRM College and at Pondicherry University. She has a teaching experience of more than 16 years and has guided several graduate and postgraduate students for their research work. Ma'am has several publications to her credit in national and international journals, and we are extremely happy to have you with us here today, ma'am. Welcome. And I now request Dr. Anandi to kindly take over the session and introduce our esteemed panelists. Discussion. Thank you.
Thank you, Dr. Rucha, for such a nice introduction. A very good afternoon to the dynamic entrepreneurs, dignitaries, and the esteemed audience of this session. At the outset, I wish to thank respected Dr. Razia for inviting me to chair the session on challenges in setting up the private practice in cardiopulmonary rehabilitation. From the earlier times until now, it is a trend that the word physiotherapy is synonymously used for musculoskeletal or neurological physical therapy. Even in academics, most students tend to consider cardiorespiratory specialty as an adjunct and never the main course. There are very few students who join cardiorespiratory physical therapy out of passion. So till date, cardiovascular diseases being the #1 cause of death globally, which results due to improper lifestyle, it is common to hit through a physiotherapy clinic which caters for neuromusculoskeletal problems and very rarely a private cardiopulmonary physical therapy center. In this situation, it is the need of the hour to converse with the most dynamic physiotherapists from different parts of Maharashtra especially, who ventured private cardiopulmonary physical therapy practice. And we want to know and share your experiences by this session. May now introduce our participants for today's panel discussion. First, I would like to introduce Dr. Asavari Page. She did her Bachelor of Physiotherapy and Master of Physiotherapy from Seth GS Medical College and Kem Hospital, Mumbai. And she headed the Department of Cardiac Rehabilitation, Asian Heart Institute, Mumbai. She has worked as a physiotherapist in Michigan, USA, worked extensively in the field of cardiac rehabilitation since last 15 years in Mumbai, USA, and Dinanath Mangeshwar Hospital in Pune. And she has an integral part of core team of doctors which conducted redo coronary artery bypass graft surgery on Dr. Manmohan Singh, the then Honorable Prime Minister of India. At present, she is consultant and founder at Aloha Lifestyle Reversal Studios, Pune. Welcome you, ma'am. Next, I would like to call upon Dr. Purvi Devani, who did her Bachelor of Physiotherapy from VSPM's College of Physiotherapy, Nagpur, and Masters from Seth GS Medical College and Kem Hospital, Mumbai. She has experience of working as clinical physiotherapist at several hospitals in Nagpur and Mumbai, and presently working as a chief physiotherapist at Pratibha Prabhakar Pulmonary Rehabilitation Center, Mumbai, since January 2012 till date. She has recently been appointed as the treasurer of the Society of Cardiovascular and Pulmonary Rehabilitation. Welcome, Dr. Purvi. Next, we have Dr. Sejal, who graduated in 2013 and post-graduation in 2016 from Seth GS Medical College, Kem Hospital, worked at Asian Heart and Breach Candy Hospital, Mumbai. And she was responsible for setting up and running Cardiopulmonary Rehabilitation Center at One Heart Clinic, Chembur. And she was associated with Kotak Mahindra Bank as consultant physiotherapist since 2017 to till date. And she has founded Care Physio and Rehab, a specialty clinic for cardiopulmonary rehabilitation at Sion, which successfully completed 2 years in Jan 2022. Welcome, Dr. Shejal. I would like to introduce Dr. Cheryl, who completed her BPT from MAER Physiotherapy College and Master of Physiotherapy from Seth GS Medical College and Chem Hospital, Mumbai. And presently, she is a founder and director at Heart Lung Care Physio and Rehab. And she is a certified cognitive behavioral therapy practitioner. And she has worked at frontline physiotherapist during COVID-19 pandemic at Chem Hospital, Mumbai. She actively participates in organizing webinars for improving patient care as well as therapist knowledge of rehabilitation. Very happy to welcome you all for this panel discussion. At the outset, I would like to know from Dr. Cheryl about who has recently started her center, maybe about 2 years. And let us know what motivated you to start a private practice for cardiopulmonary physical therapy.
Thank you, Dr. Anandi, for giving us this opportunity to share our experiences, and also Scientifica for this platform where we could actually share our experiences. Okay, so coming about motivation, first thing which I would say is the patient need. Like, I did my master's in cardiorespiratory physiotherapy from a tertiary care hospital in Mumbai, and I am located in suburbs of Mumbai, Vasai, which is in the suburbs of Mumbai. So I used to see many patients traveling very far to this hospital. And in general, I felt the awareness at the same time, the transport, the accessibility is really a problem for patients to follow up and also to consult. We tell them you need to come back, it's difficult for them. Second thing which I would say is I believe in rehab being in the locality because of the symptoms, because of the conditions which respiratory or cardiac patients face. We need to think about many factors. For example, how easy they will be able to transport, the accessibility. So that was the second thing. One more thing is the less rehab centers, along the, even Maharashtra or overall. So, if we have more rehab centers, it will be more easier for patients to travel and get benefited. And one last thing, of course, the pandemic itself was a motivation because I started in the middle of the second wave. It was a difficult task. I had a talk with senior colleagues, my mentors, to decide on this. So basically, the need of the patient is, I think we need to think, and that motivated. Yes, and the passion for cardiorespiratory physiotherapy, because when I came across, I felt the need of it, the awareness, and to develop more physiotherapists like us, to work together as a team was indeed a motivation. Thank you.
Thank you, Dr. Cheryl. May I get to know from the same details from Dr. Asavari, because she has started it over 10 years back, and what motivated you to, and how were you, able to start a private practice in cardiorespiratory?
Yes, thank you. Thank you, Anandi ma'am. Thank you, Scientifica. Thank you, Sancheti. Thank you, Dr. Razia, who have given this opportunity to be here, and it's wonderful and pleasure and honor to be here on this forum. So what really motivated is, I would say, right from my undergraduation and post-graduation days, that is back in KEM Mumbai, I had a strong urge towards cardiopulmonary rehab, and actually my dream was to have someone with an open heart surgery run on a treadmill. And I think I just followed my vision. In the last 15 years, I guess I was fortunate enough to have an opportunity to work in my specialty of cardiopulmonary rehab. But I think somewhere the challenges faced were of of the dearth of outpatient cardiac rehab facilities. And I guess the main two challenges which I felt was obviously the emergency backup that we need when we are seeing all high risk individuals. And secondly, the monitoring devices or the monitoring technology that was lagging to have these high risk individuals exercise in front of you in an outpatient facility. So yes, we did keep working on these terms, and I actually had started a cardiac rehab program, a structured one with multidisciplinary approach in Dinanath Hospital. But again, it was a hospital setup, and there are certain people, there are certain individuals whom I realized over the years that would love to come for a supervised session for a limited time, and they would actually rather go to a club or a gym where they may not get any medical facilities, but they would rather not come to a hospital for an outpatient, for a rehab. So that everything motivated me to start a clinic or a facility which would be like an outpatient facility with emergency backup, with and a clinic which does not look like a clinic. It should have an ambience which would not make them more phobic towards exercising. And I think that was what my motivation to start a private outpatient rehab facility. Thank you. Can't hear you, Anandi ma'am.
Ma'am, you're on mute.
Anandi ma'am, could you unmute yourself?
Yeah, sorry. Sorry about it. Dr. Cheryl and Dr. Asavri, thank you for sharing your motivation points. I would like to know from Dr. Purvi, what are the specific guidelines you think that needs to be followed to start up a private practice?
Yeah, good afternoon, everyone.
Like, are there any shop act or any business registration you think that needs to be done?
Yeah, good afternoon, everyone. So, first of all, I want to just congratulate everyone that, we are in a pulmonary rehabilitation awareness week. We just started from today, and after that I'll start my answer. So the thing is, guidelines, we need to follow the guidelines. That is very important. So when we started pulmonary rehabilitation programs, so all these guidelines are like ATS or ERS guidelines, American Thoracic Society or European Respiratory Society guidelines. So we just need to follow the guidelines, but we have to formulate a program according to our patient population, Indian patient population and Indian culture. That is very important. Like in our culture, mostly for like breathing issues or for this chronic respiratory disease patient, pulmonologists used to say do yoga and pranayama. So that was a thing. And when it is very important to formulate a proper structured program for this patient. So we need to follow the guidelines, but we have to formulate according to our patient population, Indian patient population.
Okay. Do you think that a geographic survey needs to be done before starting a setup like this?
Yeah, definitely, because it's a OPD based rehab or OPD based community program. So here, as Dr. Asavari said, the risk is also there. So first thing we need to see that maybe the secondary care setup or a small ICU or maybe a small hospital should be nearby. And not at least tertiary, but some secondary should be there, so that we can communicate with those consultants, and if any emergency happens, then immediately we can shift our patient to that place. So that is very important. So like in our setup is like 200 meters away from one ICU, and we are in collaboration with that ICU. So anything is there, any risk is there, or if any problem happens, so we have that contact. So that first thing we need to consider, very important for patient safety. And the second thing is about how many physicians are there, like chest physicians or MD physicians are there who can refer for pulmonary rehab. Exactly. That is also very important, because our practice is a referral basis. Like initially it was, Now definitely people come from internet inquiries, and they have that knowledge from Google, so they come. But initially definitely we had to see how many physicians are practicing in that vicinity, maybe 2-3 suburbs from our setup. That was a survey we need to do it.
All right. So that goes interesting. So I think all of you have made a preliminary geographic survey and the needs of the people before you have started. And I would like to know about, as a starter in the starting stages, what was the equipment procurement that you had to make? Dr. Shejal, can I have your views on this? What were the basic list of equipments you wanted to have in your setup?
Sure. Thanks for having me here. I would like to thank Dr. Anandi, Dr. Razia ma'am, Scientifica team, and Sancheti Hospital and College for organizing such a great event. Once we were the participants, today it feels great to be a panelist here. Thank you. Coming back to the question, to begin with, I had the most basic equipments to begin with, because I was all alone to begin with. It is not in association with any chest physician or a cardiologist. So to begin with, I had treadmill, cycles, so all the equipments required for a basic aerobic and strength conditioning. So stepper, therabands, weight cuffs, balance equipments, because most of the patients are in the geriatric population. So we can't just focus on heart and lung, but other integumentary, musculoskeletal, balance, nervous system, all the systems we need to target, because rehab is not just one organ. It's, the overall training that you do for a person to become independent, to be, self-sufficient, to increase the quality of life. So considering the patient population, I had the basic equipments of all the systems required to be trained. I did not have telemetry initially. BP apparatus, pulse oximeter, mirror, huge mirror, balance training equipments, all that we had.
All right. But presently you have telemetry too?
Yes.
All right. That's nice to know. And what about the budgeting? What was the initial startup budget you would suggest people that they need to start up a setup?
That depends actually from where you want to do it. Mumbai being the costliest, I think, the city for renting and all. So anywhere between 1 to 2 lakhs, I would say, to begin with. The most basic, that would suffice for basic equipments, and maybe a 1 or 2
as
months.
You listed the basic equipments as you listed.
Yes, as I listed, and a couple of months rent. But maybe in any other tiers, to a second or third tier city or any other remote places, it would be lesser than this. Also, there are option of renting the equipments. There are many websites now that lend you equipments on rent. So if you're tight on budget initially and not able to buy it, then you can even rent it. Once you have sufficient funds, you can go for the buying option.
Okay. I remember Dr. Purvi saying that she had first started off with only referral practices, with the doctors associating with the cardiologist or pulmonologist. How was your experience, Dr. Sharon, when you started?
Yes, so basically when I started, it was indeed, I had to think a lot, like 1 to 2 months, how to go with it. Because I was new in the town, like, of course, I used to stay there, but, as a doctor, as a professional, so I met few of the doctors, not few, in fact, every doctor in the locality, coming from general physician, MD medicine, cardiologist, diabetologist, pulmonologist. So it took me a lot, like I would say 2 months, I actually went to the pulmonologist, I had a word with them. But before going to them, I had a program, like I went to them twice, I would say. Initially, I just went to get an idea from their side. What are they expecting? What are their views about pulmonary rehab? But I was super confused about, should I tie up with a pulmonologist, in collaboration with them, or open my own, because you need to think about it, because, you're starting something which has to be, taken care of in the longer process. You just can't stop in between. So I met few doctors, and I would say, one of the doctors said, it's better you have your own setup, so that many other doctors can refer you. If you combine with one of the pulmonologists, it might be that the patient crowd won't be the same as from all other physicians. So there were many things. In fact, they were also saying that what all setups you have, how do you proceed with. And this was the first round which I went, and then I came back. I worked on it. I made a brochure. I spoke to the senior colleagues who are here with already a rehab setup. I made the indications. What are the which patients need to be referred? What are the benefits? A few testimonials which I had treated. My specialty, like what I have worked with. So it took a lot of documentation, preparing my resume, speaking. I remember I went through some communication skills and how to talk, how to be a entrepreneur, because I would say we are medically really good. We are good in the profession. We are trying to, but when it comes to interacting with doctors, with senior colleagues, that is an important thing. So after all this preparation, I went to them. I had a basic plan. I did tell them that I have started a rehab setup. It will be really great. It will benefit your patients if you refer them. You will learn it. I will say I'm still learning it. Because it's an ongoing process. So that is how I started, and I would advise being humble and telling your views, how it's going to help, because it's not the same from both the side. So I think that helped a lot. And yes, thank you. And word of mouth, yes, I would say referral basis, of course, it's important, but at the same time, word of mouth is something which I really felt works. Like one of them gets better, he goes back and he advises his relative, because I would say it is really people are not aware of it. Like I have few patients coming and they are like, ma'am, up, why didn't you meet me 2 years back? Why didn't I go rehab 2 years back? So I was at a point that at least few of them initially to start with are benefited. It's a big task, it's a big worth it. So I would say that's the way I proceeded. Thank you.
Yeah, good to know
sorry
your
to-
experiences.
Yes,
Yeah, Dr. Asavri, please.
sorry to interrupt, but I think she mentioned a very important point, which I wanted to highlight, that yes, we are really good at our profession. We know what we are doing, but most of the times where we lag as physios are when it comes to presenting ourselves. So when it is to presenting what we are doing confidently to somebody who is more knowledgeable, we have to accept the fact that yes, the professional with whom we are talking to, we have to stand at par with the physicians, with the cardiologists, with the fraternity. I think the communication skills is also something which we should accept the fact that we have to work on it. We have to maybe get some more guidance from wherever we can. And that is something which we are not trained for, I guess. I think that was a beautiful point placed.
I just want to add one more thing, that it's not only with the physician, but with the patient also, it's very
Exactly.
important. Communication with the patient is matters in rehab, because it's a long-term process. So just to, maintain their adherence is very important. For that, communication with patient and their relatives is also very important.
Okay. Can I get to know from Dr. Asavri, who is running this rehab center for over 10 years, how was this referral services changed from those times to now, after 10 years?
Yeah, I think it's been almost 15 years that I'm in this field. But yes, the referral services, I think people are getting more and more aware of the fact that cardiopulmonary rehab exists. And as I said, when I selected this stream for my master's, I had actually topped the university. So I had a scope to take even orthopedic for that matter. But at that time, I had chosen because that was my passion. But even that time, it was not so much into. But yes, of course, people have started realizing the fact that it is important. Mouth to mouth, there is a lot of branding and marketing that I think we as physios are also into it. And most of the patients are getting aware of the fact that rehab helps them, cardiac rehab helps them to get back to their normalcy quicker. And even though the referral services are improving, I wouldn't say at par at how it should be, but mouth to mouth is definitely improving. I think people are getting more and more aware themselves, going to Google, searching for it, and then coming down to a cardiac rehab facility on their own without a referral from their doctor. I think that is where we as physios are, I think, doing something which is seen.
All right. That's nice to know. Dr. Purvi, you mentioned that communicating with the patients is very important for long-term adherence. For a patient who has a cardiovascular problem, long-term adherence to a program is very, very important. And that's a very key point for cardiopulmonary rehabilitation. How do you do it? How do you manage to do it? And are there any pitfalls? Do patients fail to adhere to the sessions?
Yeah, I would like to stress on this because, when I started this rehab program, actually this process started in my master's only. Like during that period, it was my thesis to, see a effect of structured exercise program in this chronic respiratory disease patient. And that time I realized that, for 8 weeks of follow-up, we have to call them regularly, thrice a week or twice a week, and then reassess them. So that was a very big task for me. And I was studying in a VMC setup where it was very difficult for patients to, transport and come every alternate day. So that time I realized something has to be done for this. And when I started actual rehab practice, that time I started investing more on a patient education, because it was not a didactic lectures about the disease and all. But first, it was very important to make them understand what is their condition and why do they need this. And by doing this, in long term, how this rehab will help them. That was very important. So I started investing more time on, educating them in a first assessment. So once they are convinced that, okay, this is going to help me, I'm not coming just because my physician has referred, and I'm coming because there are benefits of this rehab and exercises. So once they are convinced, then they are ready to come. And the second very important thing for adherence is, you have to show them improvement. So even if we are doing assessment, we need to do a periodic reassessment, and we have to show them in a, objective measures, like you have improved in your 6 minute, or you have improved in your RPE. So there are different outcome measures we have to take, and we have to show them in numbers. So they are so excited about those numbers. So when they see their improvement after 2 months and they get their reports, they are more interested in showing that report to a physician, their concerned physician. So that was also, very important point. I understood that is important. And the second important is, like, you have to educate them. And education is an ongoing process. It was not only on a first assessment. During whole sessions, there are small things for which we have to help them so that they can cope up with their disease nicely and they understand their disease process. So that's how it helped me for adherence of the patient.
Yeah, you rightly said. When something is not measured, there's no scope for improvement at all. To show an objective way of improvement will surely make the patients adhere and come to you for a long term. And they'll be more interested also. That's right. You're very right. And as we were talking about the outcomes and measuring their outcomes, what do you think about how are you able to keep up with the recent evidence-based practice or perform a research? Can I have Dr. Purvi on it?
Yeah. So when we are doing a private practice, we all know that we are very good clinicians, and we are very good in a clinical practice. And from my master's day, my mentors used to say that you are good in this thing, but you need to document. You need to document each and everything. So from that time only, it was, bombarded in a mind that you have to document the things. And so when I started practice, first thing I did was, I made a assessment pro forma, so I have each and everything about the patient. And then we used to write down, or we used to make note of all the improvement what their patients are doing exercises. Each and every day data collection was there. And now, like, slowly from paper, we started with a computer system, our own system, where we are feeding the data. So when we are, we have data, it's very easy for research studies. So we can do retrospective studies, at least from a previous data. And it's very easy for research and publication purpose.
Yeah, thank you, Dr. Purvi. Dr. Asavri, I truly understand that no research can be followed up and a true research can be done only by a clinician. How do you take it forward in your center?
Yes, so actually we were the first center, I guess, in Pune who was doing CPET, cardiopulmonary exercise testing. So it was pre-COVID. Of course, unfortunately, due to COVID, we had to actually shut that down because of the mask involved and the things involved. But before that, we had actually done a research on pre and post CPET in post rather cardiac rehab patients, pre CPET and post CPET. And we had published that we got a chance, an opportunity to have a poster presentation done because of COVID. We couldn't go for an oral presentation in AACPPR, American Association of Cardiopulmonary Rehab. And we actually showed drastic differences in their workloads, the load and the watts that they could take, the exercise peak, the lactate threshold. So we had measured the lactate threshold pre and measured the lactate threshold post cardiac rehab. And it showed a beautiful trend where not only the exercise parameters improved, the exercise physiology improved, but we had actually also measured the HDL. So we had taken their lipid profiles pre. So that was and specifically the HDL, because we know that HDL is the one which can actually change only with physical activity majorly. So the HDL also showed an improvement pre and post. And so that was a good research thing which we had done in cardiac rehab patients which we had.
Yeah, thank you, Dr. Savri. And I remember you have a medical gym. And how do you conceive that idea of having a medical gym?
Yes, so
I think your research will not be possible without having one.
Yes. So it was a joint venture with a cardiologist and a diabetologist. So we had a huge gym setup where all the machines were connected. We had actually visited Cologne, Germany, and actually seen all the rehab centers in the Europe, and got the technology from there where we could monitor every exercise session, where your heart rate is seen, but it is a software controlled machine. So if you put a heart rate control module in it, say for example, if we don't want somebody's heart rate to go beyond 120 or beyond 130, and we put that in the software, then the software would deliver the amount of watts and the energy needed in a way that the heart rate is controlled. So there were many such monitoring parameters which the software had, and we had an opportunity to do that software thing. The software was monitored remotely by the Germans in the German sports university there, in any kind of backup we needed. But what benefited us was the monitoring of all the high-risk individuals. So diabetics, hypertensives, post-cardiac patients, post-cardiac rehab, rather post-open heart surgery. But we also had for certain patients for cardiac reversal. So people who were advised CABG, and we did a structured rehab program for them, and we actually could see the improvements in their ECG, which showed ST depressions with certain symptoms in the initial sessions, where they were actually just taking maybe say 40-50 watts to an improvement of 100 watts, which they were taking with no ST changes, with no symptoms. So if we would have done like an angiography, we would have seen maybe collaterals developing. But that was the functional improvements that we could do. But we actually could do it because of the technology that we had, I would say.